Hi, this is Chandrakanti. Good evening, all of you. Today we will discuss about the topic defibrillation and cardioversion. Okay. So before going to the topic, let's go back to the history. And the history was the defibrillator machine was discovered in 1930 by William Covenhoven, who is an electrical engineer. He studied about the effect of electric current on human heart. Okay, and then they tried ventricular fibrillation on a dog, and they gave higher amount of energy to reverse the condition in 1950. Then after that in 1960 we used the defibrillator machine for cardioversion. Okay. Next comes to the types of defibrillator. There are mainly three types of defibrillator. First one is monophasic defibrillator, that is providing 360 joule energy, and the second one is biphasic defibrillator, that is providing 120 to 200 joule energy, and the third one is automatic external defibrillator. In automatic external defibrillator there is no need any medical knowledge to use it or to apply it. Only you have to apply the paddles and the machine will recognize the rhythms and then giving shock to the patient. The difference between monophasic and biphasic defibrillator is in monophasic defibrillator that is providing higher amount of energy as compared to the biphasic defibrillator, and in monophasic defibrillator one paddle providing the energy. In biphasic defibrillator both paddle providing the energy to the patient. So next comes the term defibrillation. Defibrillation means to defibrillate a patient or a client by providing electrical energy to the patient to restart the heartbeat. Okay. Where you use defibrillation? Only in cardiac arrest, and where you find out the pulseless ventricular tachycardia and pulseless ventricular fibrillation. Okay. There is only two shockable rhythm, ventricular pulseless VT and pulseless VF. We can use only defibrillation in that condition. So in monophasic defibrillator we use 360 joule energy for ventricular tachycardia, pulseless VT and VF, or in biphasic defibrillator we use 200 joule energy to providing defibrillation to the patient. So next comes to the cardioversion. Okay, cardioversion means we are providing electrical energy to restore the normal heartbeat when your heart beating too fast in a irregular rhythm. The indications are unstable tachyarrhythmia because of when your organ perfusion affected due to MI, due to altered sensorium, due to head injury, etc. and etc. Okay, then refractory tachyarrhythmia to drugs. Okay, some drugs can cause tachyarrhythmia. In that condition we are using cardioversion to cardiovert the patient. Okay, there are normally three conditions where we are using cardioversion. I will explain it, and how much shock we delivered, how much joule we used, I will explain properly. You have to always remember that. Okay. So next comes to the energy requirement in cardioversion. How much energy we delivered in cardioversion. Okay. So in cardioversion we prefer biphasic defibrillator as compared to monophasic, because in monophasic defibrillator we are using higher amount of energy, but in biphasic defibrillator we are providing energy as much as it required. There is three conditions where we are using cardioversion to cardiovert the patient. The first condition is narrow complex regular tachycardia, example SVT, sinus ventricular tachycardia. The energy requirement 50 joule. Okay. And the second condition is narrow complex irregular tachycardia. The examples are atrial flutter, atrial fibrillation, multifocal tachycardia. Then the energy requirement 120 joule to 200 joule normally in biphasic defibrillator. Okay, the third condition is wide complex stable tachycardia. Wild complex stable tachycardia. Okay, the example is pulse with VT, VT with pulse. ओके, पल्स भी है, बीटी हो रहा है पेशेंट को, तो हम लोग उस टाइम एनर्जी रिक्वायरमेंट 100 to 200. ओके, देन I will show the parts of defibrillator. Come with me and I will show which are the parts and how they work and how will it used to providing electrical energy or shock to the patient. Okay, let's come. Now see the parts of defibrillator. There was a monitor screen and there is a pacer, the setting about automatic external defibrillator and the manual defibrillator. There is an energy selection and this is the charge button and this is the shock button. Okay, and this is a monophasic defibrillator, but there is a setting of synchronized button in this. Then you have two paddles like this. So you need to this is the paddles, and you can use for pediatrics by removing the large paddle. The pediatrics dose, 2 joule of this. So let's come to the important thing, that is the procedure of defibrillation or cardioversion. Okay, before doing any procedure, we should take consent to the patient or the family member, which is done by the surgeon or done by the assigned doctor. After consent was taken, you have to give some minor sedation to the patient or anesthesia to the patient, because it's a painful procedure. Okay, the examples are morphine, midas, fentanyl you have to use. Then energy selection, according to condition you have to select the energy. And then the most important thing is, in cardioversion you have to choose the synchronized bottom. Okay, synchronized bottom, because the energy or the shock delivered when the peak of R wave. So in defibrillation we normally giving shock to the patient and comes out, but in cardioversion we have to choose the synchronized bottom always, because the shock was delivered in the peaking of R wave only. Okay, then what happens when you accidentally does not choose the synchronized bottom? Okay, the machine was delivered the shock to the patient, but some complications are developed, like unstable tachycardia, VT, VF. Okay, or the patient may develop a sudden cardiac arrest also. So you have to always remember that when you are using cardioversion, then you have to choose synchronized bottom proper. Okay, after energy selection done, you have to apply jelly between two paddles, which is a very electric conduction or good conduction between the skin and the paddle. Also it prevents from the burn. Okay, then place the paddle. Already I was told that where you have to place the paddle. Then you have to sort I clear, you clear and all clear before delivering the shock to the patient. You have to make sure no one else touching to the patient or the bed when you are providing the electrical energy to the patient. Then deliver the shock. Okay, so it's all about the defibrillation and cardioversion. Thanks for your attention, and thank you.